Good morning, I'm Sarah.
And I'm Barb.
And today we're going to go out into the community and interview some public health nurses that are working with the homeless population.
And this is Barb at Channel 4 News.
So I'm Sarah here with Ashley, a public health nurse that's working with the homeless population. So Ashley, can you tell me a little bit about what your goals are as a public health nurse?
Yeah, Sarah. So my main goal as a public health nurse is to improve the healthcare within the homeless population.
Neat, that's awesome. Can you tell me a little bit more about how you accomplish those goals?
So as a nurse dealing with the homeless population, we work to address acute and chronic health issues within the homeless population.
Okay.
So we assess their healthcare needs, we perform any first aid or injury care that they might need. We do a lot of health education. That's a really big part of being a public health nurse, is that we educate a lot. And then we make referrals to healthcare providers when necessary.
Cool.
And so, for example, just this past week, we held kind of a flu shot clinic type thing where we took flu shots out into the population and were able to administer flu shots to people that weren't able to go to clinics to get them or go into their doctor's office because they don't have insurance. So we were able to bring the flu shots to them into the homeless shelters and out into the community. With that, we did a lot of education with these flu shots so people understood their purpose and were more likely to seek out preventative health measures like the flu shots so that they don't get the flu. And then we found out that the people that were participating in these health promotion activities were more educated about communicable diseases and were wanting to prevent them more. And so it just kind of went full circle, and we were able to prevent more people from getting the flu and do a lot of health education as well.
Great, that sounds like a wonderful accomplishment.
Yeah, we were pretty happy with it.
So just out of curiosity, what are some health issues that you encounter in the homeless population?
So there's a lot. So being homeless can actually exacerbate a lot of existing problems and create new health issues for these people. And so we work really hard to manage their health as one of our biggest responsibilities as public health nurses with the homeless population.
So you helping them manage their health, what does that look like exactly?
So people that are living on the street and in crowded shelters, that places the homeless people at high risk for certain health problems, including infectious diseases. Additionally, people that don't have homes don't have refrigerators, and so people that are diabetic don't have places to store their insulin, and so their diabetes is untreated, and they can get problems from that can lead them to get worse health outcomes. And so we want to teach people to be eating a balanced diet and just general health promotion, stuff like that, because being homeless doesn't really bode well for living a super healthy lifestyle. So for example, diabetes and asthma are two of the most common problems that require vigorous self-care management, and these homeless people don't really have that option to be able to be getting the care that they need. And so diabetics have to be aware of the effects of diet and exercise, and they need to have a cold place to store their insulin. And so without a place to live, there's little control over those symptoms, and there's little control over their health when they don't have the appropriate means to be able to help themselves.
Gotcha. Thank you, Ashley.
Yeah, well, thank you for having me. Hello, welcome back to Channel 4 News. I'm Barb, and I'm here with Shannon, another one of our public health nurses working with the homeless population. So Shannon, can you tell me a little bit about the social issues that can complicate people's health when they are homeless?
Of course. So some of the social issues that we see in the homeless population that they're at risk for is substance abuse, rape, and mental health conditions. And we as nurses try and provide resources for these people to help them overcome these obstacles.
Oh wow, that's really awesome. So what are some of those resources that you guys help with?
So in general, we try to provide care towards helping these homeless people rebound from traumatic experiences. And we also assist those that are struggling with substance abuse to overcome those negative habits. And we also refer them to the community resources to help them find jobs and financial aid and housing so that they can have a better chance of transitioning normally into society.
That's really awesome.
And some more specific resources
Yeah,
that we use. For example, we refer them to Centers for Battered Women, drug and alcohol treatment centers, as well as transitional housing and emergency and homeless shelters. So those are the different resources that we refer our homeless population to.